In the Bay Area right now, in the East Bay, hundreds of Sutter healthcare workers are on strike.
Yeah, they are. This is in Antioch. They're protesting staffing shortages and unfair labor practices. KRON 4's Will Tran is out there this morning. And Will, if I remember correctly, you said this only affects the Antioch Sutter Hospital. Is that correct?
Correct. Only this hospital, not the other Sutter Health across the Bay Area. We're talking about 350 healthcare workers, and that includes some of the respiratory therapists, and you can see them in their scrubs here. It's across the board. People who transport people back and forth from the hospital. They are 3.5 hours into a 5-day strike, and you can clearly hear how loud it is. They're getting support from the people driving by. They claim that they're already overworked and understaffed even before COVID-19, and COVID-19 is taking a bad situation and making it worse, and they want to send their message to their bosses that they need help, not so much in terms of a pay raise, but more manpower so they can take care of their jobs and, in essence, take care of the patients. Here's what you need to know. If you have an appointment today, Sutter Health has brought in other people, replacement nurses, replacement workers, to take care of the needs, and I'll talk about that in just a few moments. In the meantime, let's talk to some of the people on the picket line, including Stephanie here. How is just on a daily basis, you clearly say that you're overwhelmed. Can you walk us through some of the activities that you feel overwhelmed?
Yes, so we come into work, we're short-staffed a lot. Sometimes we need 7 or 8 RTs, and we will only have 3 or 4. So you have to understand that we're carrying 2 to 3 people's workloads a day. So we do 12-hour shifts already, which is hard on your body. We're staying 16-hour shifts. We're working 14 days straight, and there's too many patients to care for. We can't give them the adequate care that we feel they need.
So then you're not looking for the pay raise, so to speak. You just need more help on the way.
Yeah, so they did a hiring freeze during COVID. So there have been people that have left the facility, whether they've retired or resigned, and Sutter does not post the positions. So we've had a ton of people leave, and we haven't gotten more positions. We only have an EKG tech until 11 p.m. There's no EKG tech after, I believe it's 11:30. So there's no EKG tech at nighttime, all the way till 7 a.m. The RTs, which were already short-staffed, are having to pick up and do the EKG's job as well because they don't want to put an EKG staff person on throughout the night.
So clearly you sound very frustrated.
Yeah.
And when she says RT, she means respiratory therapist. Take a look at your screen. This is what Sutter Health wants the public to know. They saw our reports, and they want to make sure that the people out there, talk about instant results that we got, they want to make sure that people know that they can still come in. They say our priority is providing safe and accessible patient care, despite the disruptive actions of the union. By bringing in qualified staff and adjusting some schedules, we are able to help ensure the majority of Sutter Delta Medical Center's operations will continue as normal, including emergency services. So they are doing their very best to make sure there is no disruption in service, but you can clearly see there is a disruption in the front. So even if you go by, and we did see a lot of the replacement workers get heckled, nothing violent, get heckled as they were brought in by buses. More reaction coming up at 9 o'clock. Back to you.
All right. Thanks a lot, Will. And the